deal with all the addictions and stresses, avoid stressors situations, change your reaction toward the stressors, or probably accept the stressors. So that is all stress management techniques. But as I was telling about the human emotions, the suppressed emotions, the positive emotions, negative emotion can also play very important role in a cancer. So these are all positive emotions here, and these are all negative emotions here. We have to practice more and more positive, like gratitude, love, bliss, peace, hope, faith, surrender, devotion. And we have to reduce these negative emotions like anxiety, anger, hatred, ego, fear, envy, greediness. So essentially, it has a scientific explanation for the human emotions are whenever you are in positive emotion, positive thoughts, these happy hormones get secreted. These are dopamine, then endorphins and oxytocins and serotonins. These are feel-good hormones. You feel good. The sense of well-being is there. And when you are in stress, in negative emotions, all these cortisol, steroids, they get into the action, and then you will have more, blood pressure will increase, sugar will increase, and then, of course, that is needed for that particular time. Whenever you go from that stress period, acute stress, it is important. Small amount of stress is always important, but not always. Suppose you have a car and there are 4 gears or 5 gears depending on your car. Of course, you require all the gears, first, second, third, fourth, reverse, correct? But what will happen? Suppose you always drive your car in first gear, always on first gear, the machine will get broken down. So the same way, if you always been agitated, stressful in your day-to-day life, then obviously your body will get broken very easily. Of course, there are times you have to, but again you have to know few techniques how to cool it down. Emotional health is what about perceiving the emotion, understanding the emotion, and managing the emotion and using the emotion. That is all called emotional intelligence. Why I am saying this, because I found this is helping me in my day-to-day practice. When I deal with cancer patients, I have to back up my treatment with these emotional, because there are unmet emotional needs. I have to utilize them, and also for myself and also for the patient. So thoughts and feelings are very important. There are many emotional drama will go on in the family, or maybe as per the individual is concerned. So we have to see from a third person, like a seer and doer, or knower or doer. You know you are going through some stressful situation, but you have to observe your own thoughts, your own feelings, abstain from action and decision making during emotional environment, self-appreciation, self-criticism, all are the techniques. So I always give this example. See, signal. Everywhere there are signals. There is a red light, there is orange light or yellow light, and there is a green. So use this whenever you go through some emotional situation. Just identify the emotion and source of emotion. Stop there. Identify what is causing this. Second, when there is a look, that is in orange or yellow light, be aware, note down, introspect what is happening. And third, green light, then you channelize the information, what you got, and then you move on. So this is very helpful in our lives also, and whenever we tell to the patients for them. Negative thought, that is a cascade. So we have to know that, teach them the thought stop technique, because one thought will lead to negative, and then he will be depressed in anxiety and despair. So we have to teach them the thought stopping technique. And then these are many papers already there in the literature that whenever you are in disturbance, just think what is causing disturbance. At the same time, utilize your gratitude. What you have, you are not recognizing that. Suppose a wood, piece of wood. If you keep too close to your eyes, even you cannot see the sun. You are taking only negative things in your life, and then you are, neglecting all good things happen, right thing happen in your life, and then you are becoming stressful. So practicing gratitude or being happy is already there. And if you follow that, the outcomes improves. And there are some things on the placebos also. Placebos, you give medicine and without medicine, and sometimes you feel that there is something, even if you're not giving medicine, something is working. So what it is basically the activation of endogenous opioid system when we give placebo medicine to them. It's activation of nuclear accumulans, amygdala, periac, gray matter in the brain. And it simulates that you are giving medicines, thinking that you are becoming better, and that is acting. Many times we see, and that is practicing all over the world many times, maybe some wrong times, sometimes good times, but the intentions are, we have to judge the person, but many times we just give some simple medicine and patient says that, oh, I recovered very well. In fact, there was no medicine. So many times it happens. So that is the placebo effect. And then it is always mind-body medicine. Mind-body connect. Some way our body is connected with the mind, and the way we process it, we manifest it. So we have to practice this all relaxation therapies, meditation, mindfulness, social education approaches, and cognitive behavioral therapies, biofeedback therapies, guided imagery, all those things which, if we tell the patients, and really it has been shown the effect in many patients and it has been practiced, something called as autonomic healing. So there are two systems, as we know, sympathetic and parasympathetic, correct? So the balance between sympathetic and parasympathetic system, that gives you the, your inner strength, your inner well-being, and whatever external medicines, whatever external treatment, what we are giving, it actually modifies it, it takes it to your higher level, then it will utilize in much better way. Placebo effect, as I told, feed you hormones, neuro-linguistic association, and you are also a cosmic field into the biomagnetic field. And positive affirmations. What are the prayers? Prayers are nothing but a positive affirmation of yourself and from others. So visualization techniques, verbalization, vitalization, these three V are very important for the fourth V, that is victory. So always you have to tell yourself that, okay, I am becoming good, the treatment is active. You have to visualize yourself that you have recovered already, you are doing your job, you are very happy in the family. Verbalize, tell it again and again. Let your mind know, let your subconscious know. And vitalization, it has to be your part, it has to be in your DNA. And then the magic of healing yourself or heal thy yourself, or the healing power is between you. Of course, we have to supplement it with the other external medicine, but if these go hand in hand, I think the results are miraculous. So basically these are two systems what I was talking, sympathetic and parasympathetic. So whenever we are in sympathetic state, that is stress, all these alpha waves, beta waves, memory decreases, limbic system is activated, your balance, homeostasis inside the body is disturbed, then heart rate is increased, respiratory rate is increased, blood pressure is increased. Versus you are in parasympathetic state, where it's kind of meditative state, where increase alpha waves, decrease beta waves, your cognition, memory will be good, your cardiorespiratory status will be good, heart rate, respiratory state, BP, everything will be under control. So all those things are there. It has been proved in the science